I'm Jennifer Lewey. I'm a cardiologist at the University of Pennsylvania, and I'm chair of the writing committee of this AHA scientific statement on optimizing cardiovascular health for individuals who had adverse pregnancy outcomes. Adverse pregnancy outcomes are associated with an increased cardiovascular risk in women, and two recent AHA scientific statements have summarized the data on that nicely. But the question remains, what do we do with that information, and how do we help prevent cardiovascular disease for women after pregnancy? At least half of the excess cardiovascular risk associated with adverse pregnancy outcomes is due to hypertension and other traditional cardiovascular risk factors. As a result, it's important that we focus on preventive therapies to help reduce cardiovascular risk after pregnancy that we know can work for postpartum individuals. Cardiovascular disease is a leading cause of death in women in the United States, and we know that cardiovascular deaths are increasing over time. So now is the time to act to provide early education and preventive therapies to reduce the burden of cardiovascular disease in women. The postpartum period can be a challenging time for new mothers and parents. However, there are strategies we can use to reduce cardiovascular risk early after delivery. We know that breastfeeding is good for infant health, but breastfeeding or lactation also has maternal health benefits and is associated with a lower risk of hypertension and diabetes. Contraception is, of course, important to prevent unwanted pregnancies, and luckily most contraception is safe for individuals who had adverse pregnancy outcomes, but we want to be careful to avoid estrogen-containing contraception for those who have ongoing hypertension or take medications for hypertension. Treating blood pressure early after delivery is an important part of preventing maternal morbidity and mortality. And for women who are considering a subsequent pregnancy, making sure their blood pressure and glucose is under good control in that interpartum period and during the next pregnancy is also really important. Providing counseling on lifestyle changes, healthy diet, weight modification, physical activity is also really important for individuals to hear about how they can change their lifestyle habits at home. And in Table 1 of the statement, we have specific counseling suggestions on what to say to individuals in the postpartum period about this.